Good morning, ladies and gentlemen. Previously, I've given you a lecture before on the practical aspects and the clinical aspects during a previous talk. So this time we go a little bit more to the theory behind peptides and exosomes. Right. First of all, proteins. We talk about proteins, very basics first. Protein is basically a chain of amino acids. And proteins differ from one another by the sequence of amino acid. Different sequence of amino acid, different protein. Right. Proteins, as you know from your days in biochemistry, starts as a primary structure. It combines to form a secondary structure, which is your peptide, and then it goes on to form tertiary and very complex quaternary structures of protein. Yeah, so what we are talking today is peptides. Peptide is basically a short chain of amino acids, less than 50 amino acids in this chain. Okay, right. So, what is important about peptide treatment is the building block. As I've insisted a few days ago in my previous lecture, every peptide treatment you do is an investment to stimulate your own body cells to create new cells that you require. This is a continuous process of regeneration. Unlike drugs, which you have to continuously give because the dose will decrease and decrease, this one, the peptide you give, is an investment to build cells. So, where can you use peptide therapy in the body? You can use it in anything from antihypertensive, antioxidant, for dyslipidemia, for anti-aging, to immunomodulation, to metal chelating, your heavy metals, and antioxidants and antimicrobial. So the use of peptides in the body is vast. Right. So why peptide? Why do you want to take peptide and not other cells? Number one, compared to smaller molecules like exosomes, they are specific. Small molecules goes everywhere. They penetrate all over. They stay in your intercellular space and can go to any cells. But peptides are more specific. They go to the targeted cell. They have very good efficacy and a very good safety profile. Now, compare peptides with bigger molecules. For example, your biologicals. What is the advantage of having a molecule which is the size of a peptide? Low immunogenicity. The bigger the molecule, more complex. Higher chances for allergies. Okay, so lower immunogenicity, better membrane permeability into the cell. Bigger molecules take bigger process to go into the cell, be it pinocytosis, endocytosis, whatever it is. Smaller molecule, easier penetrability, and compared to your biologicals, peptide is cheaper and a better investment compared to a drug. Right, so this is the reason why I choose peptides. Next slide. Okay, since my talk is on skin and aesthetics, we start with the skin. The skin is a complex barrier organ. It is one of the main and easiest manifested features of aging. Aging is most evident on the skin, yeah? Right. So, what are the proteins that you have on the skin? You have collagen, you have polypeptides, you have amino acids, you have proteolytic enzymes, and you have cell derivates. Okay? All these are found, these are the forms of protein you have on the skin. Now, how do we use peptides on the skin? Mainly, we use it for anti-aging. I think in a previous lecture, I've shown you all the examples. So very quickly, I explained to you the anatomical changes of the skin in aging. The epidermis thins. The dermis level, where your collagen elastin is present, loses cellularity, becomes more lax, and your subcutis, where your fat is, loses density, making your skin thin. Right. So what are the factors influencing aging? The most important external factor is UV radiation, whereas among the internal factors, it is genetic and skin diseases. Next slide. So these are the features of aging that you see. More everything from ptosis to skin laxity to folds. Okay, all these things you can see in aging. And of course, in the neck you can see the platysmal band. Yeah. So what are the biological options to treat skin problems? We know the conventional options. Here are the biological options. You can use proteins in the form of enzyme, peptides, amino acids. You can use cells. Now this is new area, nucleic acid, getting popularity around the world. It is very fine, nucleic acid, so peptides are larger, and you can use microbiomes to improve. But this is an indirect method. The other three are directly injected to the skin or topically targeted to the skin, but microbiome indirectly. So peptides that we can use for the skin includes placenta, skin, and mesenchymal cells. These are some of the results I showed you from yesterday regarding how beneficial peptides are for the skin, and this is another one. Now, I show you other publications on the benefits of peptides. Here in this patient, in this study, what they did is they applied a topical peptide onto the skin, and after 16 weeks, they found there's an increase in collagen and extracellular matrix buildup under the skin, and there is also a decrease in the breakdown of collagen. Overall, what the study found is there's an improvement in the hydration, elasticity, density, and roughness has reduced on the skin. Now, another study, this one topically applied peptides for fine wrinkles. As you can see from the picture on your left, these are crow's feet. And the improvement at the end of the study, the fine wrinkles improve. We are not talking about the big, large wrinkles. These are fine wrinkles, and they also improve with treatment with peptide from this study. Right. Now we go to a little bit more details on exosomes. Let me show you the theory on exosomes. The exosomes I'm referring to in my future slides are all mesenchymal cell exosomes taken from all over the body. So what are exosomes? Exosomes are extracellular vesicles. They are secreted by all cells in the body. They contain things like protein, lipid, and also nucleic acid. Now, what do certain exosomes contain? Some contains enzymes, some contain signal molecules, some contains matrix RNA, some contain microRNA, and some contain protein. All these based on the indication. What do you want that exosome for? Okay, you can make the exosome with all this inside according to what you want. Right, so this is how exosomes work. Like I said, this is the sending cell. It sends out, secretes the exosome. It goes to the targeted organ or tissue or cell to bring about the desired result by activating that cell. This is what is exosome doing in a nutshell. So what do you use exosomes for? You can use it for everything from angiogenesis, wound healing, managing waste in the body, to apoptosis. Okay? It can perform many different functions on the body. What I want to stress on is the indication for exosomes on the skin. They can contribute towards wound healing by reducing the expression of interleukin-1 beta, interleukin-6, and TNF-alpha, okay, and increase collagen production. Okay, they can help in anti-aging. They can help in pigmentary diseases, and they also help in hair regrowth. These are some of the functions of exosomes on the skin. Next, these are examples of exosome treatment on the skin. Here's another example, this one for post-inflammatory hyperpigmentations, what aestheticians call PIH. Yeah. Next, I show you a little bit of theory on hair studies. Okay? Okay, the hair is a very important organ for the body. You find hair all over the body except it cannot grow on the palms and on the sole. Okay? It's a multi-billion-dollar industry. So this is something everybody should participate in. Okay? Right. So what is the problem with the hair? The problem with the hair is it doesn't grow where I want it to grow on my scalp, but it grows everywhere else where I don't want it to grow. That's the problem. It's not growing in the right place. Okay? Right. So ethnically, hair differs from region to region. Asian hair tends to be long, straight to slightly wavy, whereas Caucasian hair tends to be more wavy whereas African hair tends to be more curly and twisted. Okay? In cross section, Asian hair is round, Caucasian hair oval, and Afro hair is more elliptical. So, hair grows at different rates on different parts of the bodies. Now, those aestheticians that use your diode laser, you know that when to do the next session of your hair removal based on the rate of your hair growth. On the scalp, it grows slightly more than 1 centimeter per month, 1.2 to 1.3 centimeter per month. Whereas on the eyelashes and eyebrows, it is much slower at 0.4 centimeters per month. When on the beard and mustache, slightly faster, 0.5 centimeters per month. So from here, you can gauge how often you need to do your hair removal using your laser. Right. So this is the most important slide. Hair grows in a cycle. There are 3 phases in the hair cycle. The anagen phase, which is the growth phase, it lasts 5 to 6 years. Then it goes to a transition phase called the catagen phase for a few weeks, 3 to 4 weeks. Then finally it goes to the telogen phase, which is the resting phase for 3 to 4 months, where the hair is shed off and new hair grows. All hair disease is based on this principle. Any disturbance in this cycle will cause a hair disease. So, as you can see, the anagen phase, hair grows, goes to a telogen phase where it rests, and finally, catagen phase where it rests, and finally telogen phase, the hair sheds off and new hair grows. So if you were to see any part of the skin, you can see hair in different phases of growth at one time. So all disease based on the hair cycle, disturbance in the hair cycle. So this is just something relative to tell you. So I'm just showing you subjectively. It is normal to lose 50 to 100 hair per day. Okay? Everything on the left is still normal. If you wake up in the morning on your pillow, you have this much of hair, it is still normal. Or when after a bath, you see in your sinkhole this much of hair, it's still normal. On your right, more than 200 strands of hair per day, this is abnormal. This is alarming, especially for ladies. Ladies will come to the doctor first if they have hair loss compared to men. Right. I'll talk a little bit about hair disease. Androgenetic alopecia, this is male pattern baldness. We also have a female version. It is the commonest hair loss in men. What happens is there is a genetically programmed hair loss with a certain pattern over the scalp. Okay, as you can see here, the loss is from this diagram. This is the pattern of the loss. It's lost in a certain pattern. The hallmark of this disease is when the hair is shed off, it is replaced by a smaller, finer hair. And then in the next cycle, again, smaller and smaller until finally no hair grows. This process is called miniaturization, and this is what androgenetic alopecia is all about. There you go. Once the hair falls, smaller hair grows. This one falls off, a smaller hair grows until no hair finally. Okay? Every time the hair cycle moves, one cycle, next cycle smaller, next cycle smaller. Right? So this is the pattern of hair loss in androgenetic alopecia. It's quite common, yeah? Now, this is the ladies' version. Okay, this is female pattern hair loss, female androgenetic alopecia. The pattern is different from males. As you can see from this picture, there is always thinning in the center, the parietal area, unlike males who tend to lose it at the frontotemporal and vertex. So females do experience this, but as far as I can recall from my experience, they hardly go bald. They get a lot of thinning, but never bald. Right. So now, another disease, alopecia areata. This is acute inflammatory hair loss. This one, immune mediated. Okay? There is something in the immunity that causes hair loss, a patch of hair to be lost. It is more common in teenagers and young adults. Okay, you get one patch or many patches, as you can see from this, and the size of the patches is different, making it very difficult to diagnose at time. Okay, so if you were to see the pathology under the microscope, what happens is killer T cells are found around the hair bulb, and that destroys the hair bulb, meaning making the hair to be lost. This is what the pathology of alopecia areata. This is what pathologists call a swarm of bees around the hair. Okay, and in the if you see under the trichoscope, what you get is something classical called the exclamation mark, where the base is thin and the hair gets thicker. Why is the base thin? Because it's been attacked by T cells. Finally, it gets loose and sloughs off, sheds off from the body. So this is the basis of alopecia areata. Next, telogen effluvium. What has happened is there's acute loss of a lot of hair, more than 25%, very sudden loss within a few days. Because why? In the hair cycle, all the hair suddenly move to telogen at one time. Like I explained just now, different hair is at different stage of the hair cycle. Suddenly everything moves to telogen phase and effluvium, hair loss. Why does this happen? There is a stressor, some mental stressor that causes the hair to be lost. Okay, some form of stress. Most common is pregnancy and delivery. The mother is stressed up to look after the baby, therefore the stress causes hair loss. It's something we call psychosomatic. Right. So this is the theory behind hair diseases. Now, as you can see, if you see under a trichogram, there is features of what we call telogen effluvium in the hair. The hair bulb is empty and there is no sheath around the hair. So these are the features of telogen effluvium if we were to see it under the microscope, what we call a trichogram. So now, this is the peptide study we have conducted at our center. Please bear in mind, all these are done in the name of clinical trials, okay, and investigation to improve medical sciences. Okay, so this is the peptide solution that we have told you about previously. This is the thing, and these are the growth factors it contains in the peptide solution: fibroblast growth factor, insulin growth factor, epidermal growth factor, transforming growth factor beta, platelet derived growth factor, and other vascular endothelial growth factor and cytokines as well to promote hair growth. Some of the peptide is in the hair growth, in the hair follicle regeneration peptide solution contains skin, placenta, and hair tissue. Right. Now I show you publications from other studies out of from other places. This is a study from Taiwan where they use allogenic stem cell extract. The source of the stem cells for the allogenic stem cell is adipose tissue, and they injected over the scalp for a period of 3 months, and these are the improvement. Another study, okay, more pictures from that study from Taiwan. Okay. And next, oh, sorry, I wanted to show another study, maybe I forgot about it. Okay, this is another study, very interesting study we conducted in the European Wellness. This one is for the growth of eyebrows and eyelashes. Now, we used the peptide solution and we used a tattooing device to help to tattoo microneedle on the eyelash, on the eyelid margin and over the eyebrow, and we applied the peptide solution. The peptide solution we used here is slightly different from the hair follicle regeneration. This one had a hormonal component added because for eyelashes and eyebrow, you need a little bit of hormone. Okay, and this study was conducted weekly at the center, and daily the patient applies topically the peptide solution. And at the end of 12 weeks, here are the results. The eyelash grew a good 3.7 to 4 millimeters long. 4 millimeters on the eyelash. You can forget your eyelash extensions. You can use this natural product to grow your eyelash. Okay? So as you can see here, this is how the study was conducted, and this is how we objectively measured the eyelash. Right. Next, these are the eyebrows and changes. If you see before the study and after the study for the eyebrow, you can see fine hair growing. This is what I call baby hair. At the end of the study, new hair is growing while the older ones got more diameter increase, thicker hair. So better quality hair before and after. Right. So of course, all our studies are supported by our R&D. They are all published studies. Okay, it's all evidence-based medicine. Right. Okay. So in conclusion, peptides and exosomes are excellent, novel, bioactive that give very good natural-looking aesthetic results. This is what you want, natural-looking aesthetic results. They have an excellent safety profile and they are very stable structure, very inert. Okay, so they are worthy alternatives to the conventional medicines available, therapeutic options available at the moment. That's all from me. Thank you. Right.